healthcare and climate impacts. I'm Rob Werner. I'm the State Director for the League of Conservation Voters in New Hampshire, and we're very pleased to present to you a discussion that really, I think, is getting more and more public attention and understanding, and that is the impact of public health and climate. And we're very fortunate to have with us today three representatives of a group that has made quite an impression in a very short time in our state of New Hampshire, New Hampshire Health Care Workers for Climate Action. It's only a few years old. It is part of a national group, Medical Society Consortium for Climate and Health. But heretofore, before this group was formed, there really wasn't a venue for the broad healthcare community to gather to talk about these particular issues, offer solutions. And there are so many public health impacts that we are becoming more and more aware of, unfortunately. However, it does have a flip side, I think, of concentrating people's minds in terms of, yes, we see these impacts in our lives. What are the solutions? What can we do in terms of rapidly deploying more renewable energy? How can we meet the challenges of climate change in a public health way in terms of what people are experiencing in terms of extreme heat and vector-borne disease and ticks and all those kinds of things, which is becoming more and more a problem because of our changing climate. What we'll be doing today is that we'll be going through a slide deck with these three folks. We have Bob Dewey, who's an MD, retired, and Vice Chair of New Hampshire Health Care Workers Climate Action. We have Suzanne Gallagher, who's an Assistant Professor of Public Health at Plymouth State University, and Carl Cooley, MD, who's also on the Board of Directors of New Hampshire Health Care Workers Climate Action. And as I say, this group has created quite a profile in the relatively short time of its existence. They do a lot of different programs on many different subjects, whether it's physical health, mental health. Certainly mental health is an area of eco-anxiety. As a matter of fact, there was an article in last Sunday's New York Times about stress and eco-anxiety. So there's a lot to discuss. And without further ado, what I'd like to do now is turn it over to Bob, but then both Suzanne and Carl will be interjecting their own perspectives. We do want your participation, your questions, and we'll be engaging you. But first, we're going to hear from these folks in terms of setting the table for this important subject. Take it away, Bob.
Okay, Rob. Well, thank you very much. We're delighted to be here. I know I speak for all of us. I'm going to stand because I can't seem to talk and sit at the same time. But before we get started, first slide, please. I want to just tell you a little bit about our group. As Rob said very generously, we came together about 2 years ago as a group that was concerned about what was going on in climate and not seeing much response, or at least an adequate response. And we are a group of all types of healthcare workers, from physicians, PAs, nurses, hospital administrators, mental health workers. We have school counselors, just a very wide gamut of folks. And we go from students, we have a big cadre of medical students and nursing students, all the way to retired healthcare workers as well. And we're statewide. And we're all volunteer, nonpartisan. And our mission is basically to teach other healthcare workers and the public about these very severe health impacts of climate change. In a sense, trying to make the climate crisis a little more personal. We hear a lot about melting ice caps and loss of polar bear habitat, and that's kind of abstract and very far away. And our hope is that by impressing upon people that these health impacts can affect them, their family, and their community, that maybe will fire up our New Hampshire citizens to be more aggressive in demanding climate solutions from our political and business leaders. We're trying to move the climate up a little bit higher on people's priority list. And we are primarily an educational program, or educational group. go ahead, please, next slide. But we do operate 5 individual working groups. We have a board of directors, and we also have an advisory board with some statewide and national leaders in climate and health. And we have 2 employees. 1 full-time employee is a director of operations, and we have a part-time director of philanthropy. Next slide, please. And these are our working groups. And I'll just tell you briefly about a few of these. Behavioral health group develops strategies to help mental health workers, teach them how to deal with clients who might be having a crisis due to a climate illness. The children's working group is chaired by Carl, who will say whatever about it.
I'm not going to stand up. You don't want to watch the process for me with my knees these days. So anyway, I'm a pediatrician and a father and a grandfather, and so my niche in this organization felt sort of naturally oriented towards children. And children are among the most vulnerable worldwide to the effects of climate change. 80% of the health impacts worldwide are going to be impacting children under 5 years old. So I felt that it's important that our organization have a particular focus on children's well-being. The thing that I'm most interested in doing through our group is activating pediatric child health care providers to be talking about climate and health with their patients. One of the things we've learned is that while health professionals, doctors and nurses and so on are considered to be trusted messengers by the public in general, but we're not conveying this message. We're not talking about it during well-child visits, during tick treatment visits, during heat stress visits to the emergency room. So we just have launched with some colleagues at Dartmouth and funding from the Irving Institute at Dartmouth, a project called Climate Informed Pediatric Care. And we're sort of coining this as what we need to become a standard of practice among pediatric care providers. And we will pilot launch this in all of the 7 Dartmouth Health pediatric clinics in the state. They serve 97,000 children and have 70 providers. And we will be going around to these practices with a climate-informed pediatric care toolkit. We have posters that go up on the exam room walls and the waiting room walls. We have other materials for them to use. We want to make this easy and not be an added burden to their already busy workflow, but teach them how to add on, by the way, the changing climate is one of the reasons that you're here today with this tick bite, or one of the reasons that it might be well to think about your child's diet and things that you can do in your personal life at home. So a year from now, we'll complete that and hopefully be poised to launch it more widely throughout New England at least, and maybe further. But there aren't any examples of health systems doing this at this time.
Suzanne will tell us about the climate justice working.
So, I don't know if it was on one more. Good morning, I'm Suzanne Gallagher, and I co-chair the Climate Justice Working Group with Semra Ayator, who is a professor environmental and public health at the University of New Hampshire. I'm at Plymouth State University, and our work together is inclusive of anyone who wants to belong to the Climate Justice Working Group to implement projects and programs across the state of New Hampshire. And right now we're really focusing on climate resilience and It's where a lot of funding streams are also headed in terms of what federal entities are funding when it comes to this work. And it really is collective and individual resilience to build capacity for social change and really recognizing the intersection of environment and human health, that really when we're thinking about problem solving, to work to solve health inequity and environmental injustice separately doesn't really work. So making sure that we're constantly thinking about the intersection of environment and human health and resilience. So that includes inviting people to the table that normally aren't invited to speak, lifting up voice of young people, kids who are recipients of policy change and legislation without actually having a voice. And so right now we're just working with different communities and school groups across the state of New Hampshire to build resilience in climate justice areas. Let me know if you have any interest in joining that group.
And next is the Education and Communications Working Group, which I co-chair. And this group is primarily involved with just trying to get our message out. We have a group of webinars. We put on educational webinars about twice a month, some geared to healthcare professionals and some to the lay public. We had a great one just last week, just about it's a little controversial topic, but the use of nuclear energy in achieving net zero by 2050. And all of these webinars are actually on our website. And on YouTube, and you can look at them at any time. They've been terrific. We also have a speakers bureau, again, trying to get just our message about climate and health out to the public, where we've spoken to a lot of Rotary clubs, Kiwanis clubs, library groups, garden clubs, a lot of student groups. We've given over 75 community talks since we've been doing that. We have a letters to the editor group that tries to get our message out in local papers. We have blog writers for the website, and finally our group also manages the newsletter and the website. And lastly, the Policy and Advocacy Working Group is a group that is there primarily to track ongoing legislation in Concord and notify our membership when it's time to jump in and talk to your local representative or write some letters. We also have a group that provides expert testimony to bills that are going through committee in Concord. We've done that multiple times. And actually this fall we've written our own bill for the first time, a bill that is going to hopefully cause the Department of Health and Human Services to open up an office on climate and health that would basically track climate health problems and then transfer that information into ways to try to come up with some sort of adaptations to these problems. So that's the organization in a nutshell. Next slide, please.
I just want to mention that we don't require people to be card-carrying healthcare workers to join the organization or to take part in any of its offerings. So feel free to step up if this is engaging to you. And I think everybody in a way for us is a healthcare worker of some sort.
This is our webpage, so write that down and you can get all the information you need right there. And if you want to join us, please do. That'd be terrific. Okay, next. All right, so today we're going to talk basically about the health impacts of climate change. We'll start with just a real primer on climate science. We'll talk about 5 individual health impacts. We have information specific to New Hampshire, hopefully. Suzanne will then talk about how climate change influences social justice and hopefully vice versa, and then close with some solutions. So next slide, please. So next. So this looks like a pretty sophisticated audience, but you know, we always get boggled down with a little bit with the difference between weather and climate. And, you know, climate change is just monitoring the change in the climate, which is weather over time. So just basically tracking things like temperature and precipitation over time is what climate change. And this is data from NASA that just show that since the post-industrial era, when we started burning fossil fuels, the temperature has gone steadily up. Next. And this, I think probably most people know, is due to the greenhouse effect. Historically, the sun heats the earth, and historically about 30 to 35% of the heat that comes from the sun gets reflected back into space. And we have this atmosphere that kind of holds us right in a little sweet spot for life. And we've been collecting these greenhouse gases, which are primarily CO2 and methane, and their molecular structure is such that they actually absorb heat. So the heat that was previously getting reflected all these years is now staying in the atmosphere, causing the atmosphere to gradually warm. Next. And this is a graph showing the concentration of CO2 in the atmosphere going back 800,000 years. And this data comes from measuring CO2 levels in bubbles in ice cores from the poles. And you see that it kind of varied cyclically between about 180 and 280 parts per million. And then when we started burning fossil fuels, it started going up. In 1950, it crossed the 300 threshold, and we're now up about 420 parts per million, and it is still going up. Next. And this is not something we've known for a long time. Scientists first described the warming that CO2 causes back in the 1850s, but this is an article from Popular Mechanics, which I remember reading as a kid. And this is dated 1912. I didn't see this issue, I want you to know. But it says here, the furnaces of the world are now burning about 2 billion tons of coal a year. When this burns, it adds about 7 billion tons of carbon to the atmosphere yearly. This tends to make the air a more effective blanket for the Earth and to raise its temperature. This effect may be considerable in a few centuries. Well, it didn't take a few centuries, as we see. Next, please. And this is some data from a recent IPCC assessment. This is, I think, from 2021, and this is the assessment that kind of fired up our group really to get started. And the conclusions here was that this is unequivocally due to human activity from burning fossil fuel. There's really no other thing that this can be blamed on in all the modeling. And at that point, the world had warmed 1.1 degrees Celsius since the mid-1800s. And at this point, we'll definitely reach 1.5. They thought by the mid-2030s, the way things are going after this last summer, hottest on record, it certainly may be sooner than that. And the reason we mentioned 1.5 is 1.5 is the degree change that the Paris Climate Accords were trying to keep us below when the countries all met in Paris in 2015. And because once you get much above that, you really start getting more aggressive melting of the ice caps and serious sea level rise. And unfortunately, New Hampshire and New England has the distinction of already being at 1.5. We're kind of on the leading edge of this thing, and the Gulf of Maine is actually in the 95th percentile in terms of warming bodies of water. So this really is a local problem for us. Next. And this is kind of a busy slide, but it shows global emissions on the y-axis, time on the x, and you can see this bottom blue line are the pledged policies from the Paris Accords, and that is where we want to be carbon neutral by 2050, and that will keep us below the 1.5 threshold. Now the orange line is the pledged policies, and the current policies are in the red up above that, so we're really not meeting anywhere near those pledges. And so, you know, it's anybody's guess where we're going to end up. But unless things change rapidly, you know, it might be in that 2.5 degree range. Next. And so after that depressing news, how does this affect our health? Next slide. So this, just to put it in a little perspective, this is an editorial from the New England Journal of Medicine from the fall of 2021 entitled Call for Emergency Action to Limit Global Temperature Increases, Restore Biodiversity, and Protect Health. And this editorial was really an attempt at a wake-up call to the medical community and was actually published in over 200 medical journals this same month worldwide. And that is the first time anything like that has happened in organized medicine. And it was really a wake-up call to the medical community saying, hey, this is the real deal. You as a healthcare provider have to know about it and how to deal with it so you can advise and treat your patients. And lastly, try to use your local influence in the community to influence the debate. And that's really, you know, that's really what New Hampshire Health Care Workers is all about. This same year, there was an article in The Lancet showing that over 9 million people worldwide died prematurely due to pollution. And NRDC, National Resources Defense Council, did a study looking at the cost in dollars of the health impacts of climate just in the United States, and it came to $800 billion. And if you compare that to my former subspecialty, cardiovascular disease, which is always the #1 killer, cardiovascular disease is only $300 billion in cost. So this really does far outshine any of those. And World Health Organization appropriately said it's the greatest health threat to mankind, causing more morbidity and mortality, certainly than cancer and heart disease combined. So next. So we're going to talk, this is a little cartoon showing what's happening. So we basically have increasing CO2 levels leading to rising temperatures, more extreme weather, and then rising sea levels. And this will cause problems with air pollution, changes in vector ecology, increasing allergens, water impacts, food and water supply impacts, extreme heat, and severe weather. And it spins off into all these other medical problems that we'll try to touch on today. Next. So we're going to talk about air quality to start with. Next. So whenever you burn carbon in any form, whether it's solid carbon, coal, liquid, gasoline or diesel, or a gas, you know, methane or so-called natural gas, you have, next you have pollutants from burning this, and those include nitrogen dioxide, ground level ozone, sulfur dioxide, and particulate matter. Small pieces of organic material as a side effect of combustion. I just want to drill down on the particulate matter a little bit. It comes in 3 sizes. PM10 they're 10 microns in diameter, comes primarily from road dust and wildfires. PM 2.5 is 2.5 microns, which comes from burning fossil fuels. And ultrafine particulate matter comes primarily from tailpipe exhaust. And you can see, and you keep in mind that a red blood cell is 8 microns, so these are really smaller than a red cell. Go ahead, next. And so when you think about it, the PM10 can get filtered out in our air passages, but PM 2.5 and ultrafine particulate matter are so small that they get inhaled deeply into the lungs, and they get into the alveolar sacs, which is where air exchange takes place. And they're so small that they can actually cross the capillary membrane, and you can get into our vascular supply. So besides causing worsening lung disease in children and adults, and they're a known carcinogen, they also cause vascular events, heart attack and stroke, because they actually do get into the systemic circulation. Studies do show that in areas of very high particulate matter, there's an increased incidence of dementia, and there's also pregnancy complications in these same populations with low birth weight and premature birth weight. Next, please. And this is some New Hampshire specific data And this is from the New Hampshire Department of Environmental Services, showing that annually, the premature death rate from particulate matter in New Hampshire, where we think we're out in the country and that we have all this great air, but in fact, it causes 1,200 premature deaths a year in New Hampshire, 67,000 lost workdays, and a total valuation of $3.7 billion just in our little state. So it really is a local problem. Next, please. Now, after that terribly depressing presentation, there is some good news in this, in that this is a problem that can be turned around. And this is a study from 1996, when the Summer Olympics was in Atlanta. We saw a similar thing to this actually during COVID, where the morning traffic decreased by 23%. There was a 28% reduction in ozone and a similar reduction in particulate matter. And during that 2 weeks of the Olympics, there was a 42% reduction in children showing up in the ER with asthma attacks. So really a very modest reduction in traffic and air quality accounted for a significant improvement in health. Next, please. And the real example of that is the Clean Air Act, which I think everybody would agree was Richard Nixon's greatest moment. And he did start the EPA. And back in 1970, when this was passed, it was the typical battle that we see today, where big oil, the automobile industry, and other industries said, oh no, gosh, we can't afford this. The economy is too fragile. We're just coming out of, we said, the usual yada, yada, yada stuff you hear anytime you try to improve the environment. Somehow it got through. Those really were the good old days, I guess. And these are the health benefits that accrued over the next 50 years. And I actually find these numbers staggering. 230,000 fewer deaths per year over 50 years. 2.4 million fewer asthma attacks per year over 50 years. And one near to my heart is 200,000 fewer heart attacks per year over 50 years. So when you sum up the savings just in healthcare, the Clean Air Act paid us back 30-fold, and which is something we see time and time again, and for sometimes we have to learn it time and time again, that when you make an incremental improvement to the environment, it pays huge dividends downstream. Now, this is a recent study from the American Lung Association from 2022, and it does show that even though things have improved, still 40% of Americans live in areas with unhealthy air, and populations of color are 3 more times likely to live in those areas. And in fact, I don't have the slide for this, I took out, but if you compare asthma rates in children of color versus white children, it's a matter of 50% higher in children of color. Which again speaks to the social injustice of this problem. We see time and time again that the people that had the least to do with causing the climate crisis end up suffering disproportionately more. This Lung Association study also just did the math on transitioning to zero-emission energy and transportation, and we're able to demonstrate that this will account for a $1.2 trillion savings in healthcare starting in the 2030s. So, and significant reduction in premature death and saving a lot of lost work days. Next.
Question.
Yes.
Just that last statistic,
Yes.
you said starting in the 2030s, but spanning what amount of time?
You know, I'm not a statistician, and I find these, but the study, and they don't go into the details of how they did this, but they said if we start this process now, by 2030, that's going to be the savings.
Annually? Or between now and then?
It was not entirely
Okay.
clear, to be honest.
Thank you.
I would read that as over an accrued period of time. I can't believe that's an annual savings, to be honest with you. I wrote the author and never heard back, actually. But I just also wanted to say one thing about pollen. as a cardiologist, I took care of a lot of patients with COPD just because smokers have heart attacks. And we would find, as far back as 20, 25 years ago, that these patients would come in the spring and early summer, wheezing, doing poorly, with really decompensation in their COPD. And I would often call either their pulmonologist or their allergist and say, hey, what do you think about giving this guy a dose of steroids? You know, the allergist would always say, oh my God, it's the worst pollen season ever. And you know, we heard this year after year, a long time ago, before we were connecting the dots. And we would kind of roll our eyes in our ignorance. Oh, he's complaining about the pollen count again. But in fact, that's exactly what was going on here. You can see this graph shows that the growing season in Concord, New Hampshire has lengthened by 34 days in the last 50 years. So these plants have more time to grow and release pollen. And we already talked about the high CO2 levels, and CO2 drives photosynthesis. We remember that from elementary school. CO2 plus water equals sugar and oxygen. And so all the CO2 makes these plants bigger, and so the concentration of pollen is even greater. So it's longer and more concentrated. And there's let's see, the peak pollen levels increased 42% just from 2000 to 2010. And it's expected to really go up greatly. Next slide, please. And I often make a comment about this, about how big the poison ivy leaves are at the end of my driveway. And sure enough, that was an observation, and it's true. If you look at, you know, poison ivy loves warm, and it loves CO2, obviously. And so it's not only making the plant bigger, it's making it more toxic. So we're going to have to really be, as time goes by, worry about poison ivy more than ever before. Next. All right, well, you're done with me for a while. Carlos,
You get to listen to me for a few minutes. I came to New Hampshire as a primary care pediatrician fresh out of my training in 1976 to Newport, and practiced there for about 12 years before I decided to become a developmental pediatrician. But during those 12 years, I saw, probably could count on my hands the number of children with embedded ticks that I saw. There were probably, it was so rare. I did teaching for students at Dartmouth who would come down, and I would always say, you've got to see this. You probably won't see another one of these. So how many here have not had a tick on their body in the last year or two? Well, it's 3. How many have had more than 5?
And have one this week.
Yeah. Anybody? Well, my wife and I we're out in the woods just about every day near our house, just going for a walk. And in the last 2 years, our first, for me, embedded tick was in February. And we obviously still have them out there now in almost October. The next slide, please. So I'm not sure I have to tell you that this is a problem and that it's a changing problem, both with respect to ticks and mosquitoes and fleas, all of which are potentially disease-bearing bugs. That's vector means a way to get disease from one host to another. And the next slide. Actually, one of our colleagues is a pathologist, and I guess really likes this slide. I'm not sure what to do with this, but these are babesiosis infected red blood cells. And but we can go on.
Well, I will say that our colleague who gave that to us said, you know, this is something you would never see, just like you would never see a tick bite. You know, 20 years ago, you would never see this, and now they see a case of babesiosis. She's had 6 already this summer, and this is kind of a rare bird. It's a parasite that gets inside the red cells, and it's usually self-limited, go away by itself, but yeah, it's on the rise.
And the next slide. So the ticks and Lyme disease are what we probably hear the most about, and there's a list of infections in addition to Lyme disease that are borne by ticks. What we just heard today that the Powassan virus, there have been 3 cases now in New Hampshire. We used to, during this presentation, say, well, we don't have to worry too much in New Hampshire about that one, but not anymore. And I would just add a personal story. 2 years ago, and about this time of year, I developed a fever and aching all over and feeling pretty miserable. And it was still, big COVID season. And so that was the first thought, and my COVID test was negative. And I went to my primary care doctor thinking that maybe I had Lyme disease because I had had an embedded tick the previous week or so. It didn't seem to have been there for very long, but I didn't do anything at that time about it. And I went on to have an illness for 2 or 3 days, a fever of 105, not getting out of bed, pretty ill. My physician had the forethought to get, he said, let's get a complete viral screen, and he sent a little bit of my blood off to the Mayo Clinic. And a week or so later, after I was well, he reported to me that it was Jamestown Canyon virus. Has anybody experienced that? I found out that I was the 3rd case in New Hampshire. Last year there were 5 or 6. This year I think there have been quite a few more of that. It's usually borne by mosquitoes, but it can be carried by ticks as well. So all of these conditions, the next slide, this is the spread of Lyme disease cases. And 1996 is not that long ago. I mean, if you think that I started practice 20 years before that, that slide, I don't know what 1976 would have looked like for Lyme disease, but we certainly didn't tend to see it in New Hampshire unless somebody had been traveling somewhere else. But the 2018 pattern is obviously more dense. This warming climate is very, very healthy for ticks. And yes? Oh, they didn't report in 1918. They don't have a magic solution.
We're just making sure you're paying attention.
And then the next slide. The longer frost-free season. That first year in New Hampshire, I had a garden, and the first frost was September 15th, and that was sort of the average time at that time. And now I don't, we don't tend to see a frost until mid-October at least. This frost-free season is really conducive to ticks and to their hosts before humans, the deer and other animals that they infect. Next slide. And this I'm going to pass back to Bob, I think.
Okay, so we're going to switch now to just talk about extreme weather events. And in New Hampshire, basically what we would effectively see is increasing rainfall, floods, and storm surge. Next slide, please. And that's primarily because these impacts on the climate are certainly somewhat regional. And in New England, we are seeing, in the Northeast, we're seeing an increase in heavy downpours. Again, primarily because the warming water causes more evaporation and can hold more moisture. And then when it does rain, it happens all at once. So the model is sort of periods of drought followed by intermittent, very intense rain. Next, please. And this just shows, this is East Coast data of just increasing tides and tidal flooding. Next, please. So in New Hampshire, it's predicted that we'll have 14 to 15 inches of sea level rise in the next 30 years. Now I find that really hard to predict because we don't even know where that CO2 level's going to crest. Hopefully it'll come down, but if we don't start turning it around, that number is probably woefully inadequate. But obviously along the coast of New Hampshire, there's lots of homes and businesses that can have damage. Next, please. And so far as the medical impacts of all of this, basically if you have increased storms and hurricanes and wind, and a tree falls on your house, then a big part of this problem is going to be accidents and traumatic injury. Flooding can obviously get into water treatment plants and sewer treatment plants, and we can have contamination of our water supply. And remember that New England was built mainly along the riverbeds and the canals and waterways, and so there's a lot of toxic industrial waste in our soil deep down, and when you have floods, that can be released. And lots of bad stuff there. And of course, if you happen to be one of the people living in these flooded houses, that would be certainly a trigger for stress and increased mental health problems. Next, please. And this,
They're also built adjacent to rivers and streams, which now subsequently flood.
yeah,
And more frequently, so in addition to the toxic soil,
yeah, they're in a bad spot. And this is just taking a look at billion-dollar disasters, and it used to be very rare back in the 80s. You maybe have 2 to 3 a year, and we had $22 billion disasters in 2020. And in fact, just because these storms are now really supersized due to the warming environment, we're seeing them much more frequently. Next. All right, Suzanne.
So my area of focus in scholarship is inequity, health inequity, environmental injustice. And so COVID helped really raise our awareness of how inequity is showing up in terms of health and health disparities in our country. And climate change is going to amplify every inequity that already exists. And if you could, Drew, yes. So this idea of planetary health, in public health, we have the social ecological model, which is intersecting layers of systems and how justice works and how equity works, how funding streams work, and starting with you, the individual, moving from there into your immediate networks, family, friends, then community, all the way up into state, nation, world. And this idea of planetary health is somewhat new as a concept that is, again, looking at those intersecting human and environmental systems. And so thinking about how we solve the problem, what actions do we focus on, really focusing on only human health and only environmental health isn't gonna cut it. We're gonna need to look at how we solve these together. And really, one of the best ways to do that is looking at how to engage people. And if we're talking about equity and health inequity, how do we engage people who haven't normally or traditionally been invited to be a part of the decision-making process, policy-making process, and then place. We're talking about rural, and health disparities show up in different ways in rural communities than urban. They're also understudied. We know a lot more about how health and healthcare shows up in urban areas versus rural areas, and then our global planet in a sense. So again, with the social ecological model, looking at these integrated systems, these integrated layers that impact health and environment, that and when we're looking at human health and health equity, these systems that cause oppression that are not the fault of the people who are recipients of that oppression. So things that were mentioned already in this talk were sea level rise. And so you've heard of redlining, which is people of color not being given mortgages. Blue lining is as water levels rise, people that are going to be mostly affected are the people living on the coastlines, and those are predominantly poorer communities and communities of color. And then, let's see, so we've talked about low birth weight, and so there's already health disparities in terms of who's having low birth weight and extremely low birth weight babies. Infant mortality, defined as death within the first year of life, it's usually within the first few hours or days, and it's because babies are born way too early. Women can't carry their babies to term because of chronic stress, and so climate change and those impacts of stress are going to be amplified. Housing. I was listening to the director of the DHHS in New Hampshire a few days ago, and she said there's a 0.6% vacancy rate in New Hampshire. There's virtually no housing in this state, yet we're gonna see an influx of people, and usually people with privilege, coming up north as the weather warms down south, and what's gonna happen to folks that might be displaced in terms of housing, healthcare access, health prevention, public health, and then these policies, so where people live really matters. If you could go on to the next slide. So this was shown already, but really looking at the different interconnected systems that impact human health when it comes to climate and weather changes and patterns. And we haven't really talked about extreme heat. We've talked about flooding, but really, thinking about how we're going to mitigate this. Are we going to put air conditioners into these units that don't have air conditioners, which is only going to go against what we're trying to solve in terms of climate change because of the burning of fossil fuels, and fans are one of the biggest contributors to climate change and electricity consumption. So how are we going to think about sustainable green building as we're building as the population grows in the state? And this is really not a very good visual, but to say that where you are born impacts your health. And there can be a disparity of 20 years life expectancy in just a couple miles. And so really, as we're thinking about solving problems, to really think about place and specifically the unique characteristics of rural and small towns. So, just looking again at heat stress and inequity, and this also has to do with community cohesion, and we have an aging population in the state, and we have a 1 out of 4 people have no person to connect to. So if they're in need, or if there's some situation where they're dehydrated, or if they are experiencing heat exhaustion, they might not have someone to go check on them, and so they're at greater risk. And we can move on. Oh, so I'm going to skip. I think if you want to, we can. So really, in a nutshell, what these slides are about is how do we engage people in communities to be a part of the policy-making and decision-making process, the aim, change, action steps. Because as it is now, we're thinking of, we have the traditional ways of thinking, and it's just not working. We're seeing, we're spending billions of dollars to try to mitigate certain healthcare outcomes, and we're seeing increases in health disparities. So we need to think of some new solutions to solving some of these problems, but really looking at involving young people, kiddos, in the decision-making process, and they have very unique ways that they interact with the environment, and we have a lot to learn from people that we normally don't listen to. So I think really that's the message of these is how do we integrate ways to help people from marginalized groups have a voice, because they haven't been heard and they have a lot of really good ideas. And I think you wanted to, I don't know how much we wanted to engage y'all in dialogue, so I'm not sure if there's slides after mine.
There's 2 more.
All right, do you want to just, let's see,
You can do
you
whatever
could
you want.
advance
Yeah.
a couple more.
We just want to make sure there's time for you all to participate.
One more, I think. Well, yeah, so, one more, sorry, Drew. Right.
So we'll just move quickly this, or, okay, so we'll talk just briefly about extreme temperatures. Next, please. The temperature is going up, and this 7 more days is felt to probably double or quadruple in the next decade. Next, please. Next, we'll skip that. The point is that health deaths are increasing, and deaths from heat are the number one death related to the climate crisis. Floods, cold, tornadoes, and whatnot are much lower down. Next, this just speaks again to the social injustice. The people who suffer disproportionately from heat deaths are in this Native Americans and African Americans. Next. We can skip this. Just finally, one warning about sweating. Sweating is our number one defense against extreme heat. And on these really hot days and humid days, it really doesn't work. In order for us to cool from our sweat, our perspiration has to evaporate. And it's actually the evaporation of the sweat that causes the cooling. And so when it's very extremely humid, which goes hand in hand with the extreme heat, that very important defense mechanism of cooling us, it becomes ineffective. Next. And so far as who's at risk here, inner city populations, we have these so-called heat islands or heat deserts downtown, where there's a lot of asphalt and not much green space, where the temperature can be 20 degrees higher than the adjacent countryside. This is very well documented, and actually building more green space in downtowns does actively cool them. And again, this just talks to some of the social injustice involved in all this. High school and college athletes, this is a group that there's increasing deaths every year in this group from August football practices, and then of course people who work outdoors, the elderly and children are also particularly vulnerable. Next.
Well, I think that it's probably obvious to all of us that experiencing an extreme weather event or a weather-related disaster, a hurricane, is stressful, and it has in some folks a lasting impact, and people who live in areas where that sort of thing happens repeatedly have a kind of cumulative impact. So there's a lot of data and research telling us what is sort of intuitively obvious, that this is a stressful set of circumstances, having global warming happening and having the consequences of that, and experiencing those consequences. During periods of extreme heat, there's a rise in domestic violence, there's a rise in other kinds of crime, and a rise in people going to the emergency room simply not just with heat stress, but with psychological stress. And the part of this impact that interests me, again, as a pediatrician and grandfather, is this notion of eco-anxiety or climate anxiety. Anybody not feeling any of that in the face of what we're telling you today? You probably came in with some to begin with.
We made it worse.
And we've just, and I think that it's important not to think of that as another mental illness. It's not pathology. It's appropriate and rational to feel some stress about this, and hopefully what that does in some people is motivate them to action, to advocacy, to voting appropriately in terms of candidates who are concerned about the climate and want to do something about it. But I also, and in our work with the pediatric clinics, one of the things that we have recognized is that children, fairly young children, are worried about it. And they're hearing, they ride to school and public radio is playing on the radio and their parent is listening to it, and they're hearing things like we're talking about today, and wondering what it means. So trying to encourage parents to talk to their kids and ask them about it, not just assume that they aren't paying attention, which is a bad assumption, I think, with children. Getting reading material. There are a lot of good children's books about climate. NASA has a kids section on its website that's all about climate and health, and it's targeted to kids. It has content that the kids would enjoy or find interesting. The American Public Health Association has a whole section on climate-related reading for kids. They have a book of the month that they feel is, you know, the current best book for children. But I think fairly recently an international study was done with 10,000 young people, not young, very young children, but ages 15 to 30 or so, and 10,000 in 10 countries around the world, a survey of their thoughts about climate. And we have a slide about it somewhere, but a high percentage of them, 76% were either very or extremely concerned about climate change. And there's also other studies that indicate that young adults are making family childbearing decisions with this in mind, feeling that they're not sure they want to bring a child into this situation. So, and that's again, from a pediatrician's perspective, something that I don't want to hear. But in any event, I think trying to protect ourselves and our children from the stresses of climate change involves action and talking both with our children and with our community members, and for me, for my colleagues to begin talking about it in the examination room as well as in the community.
Well, the question is here, is there hope? And after all this, we kind of wonder, don't we? But it is good information, and it's. I think one of the things that's a good takeaway here is that even in this era of distrust of so many institutions, healthcare professionals still have a relatively high trust level. In fact, I saw a poll a few years ago that said that nurses were particularly among the most trusted messengers. So part of this is on the clinical side in terms of engaging with patients. But then another part of it is really on the larger policy side, because one of the things that we really are about as advocates in this climate and clean energy space is trying to engage new ways of messaging and new messengers to policymakers. You know, I can go to a policymaker, state senator, and talk to them about policy and climate change, and they know exactly what I'm going to say, and they probably, or maybe they won't listen to me because I'm coming from a particular perspective. And I run a environmental climate NGO here in New Hampshire, a national organization, and an outpost of that. So I accept that and understand it, because I think that one of the things that we need to do as advocates is be cognizant enough to step back and say, okay, we're trying to influence policy and policymakers. Who are they going to listen to? They may not listen to me, maybe they'll listen to them, because there's some trust level there. So I think that that's one of the key aspects of this organization and this effort, is really to try to organize and bring together our health professionals in that larger set of trust in terms of moving policy. It also occurs to me that in all of the discussion that we've had today, the sort of the definition of health that always comes to my mind is the World Health Organization definition of health, which is not simply the absence of disease, it's a state of well-being in many, many ways. And, you know, all of these pressures are, and these aspects are bringing a lot of fissures to that equation for people. But there is hope. There are solutions. It really is, in my mind, a question of political will, because we know the solutions exist, the technology exists. We will have new technologies. We will have improved technologies around clean energy, but largely we know what to do. It's a matter of political will and making the investments and making the political policy decisions at all levels of government and society to make a difference. And although on the one hand, I do think it's safe to say that the 1.5 level that we are wanting to go to probably is not going to be met. Very likely not to be met. But there's a big difference in impact between 1.5 and 2.0. And I think our task, particularly the rest of this decade, is to really make a lot of progress on the deployment of clean energy and to really shift our focus in that way. And given the fact that we have these large national investments over the last year, that is a start that is very significant in terms of the history of where we have been. But it's not enough. So I see this, what we're calling the Affordable Clean Energy Act. Our organization, LCB, has decided to call it that and not the IRA, because some people say, why are you talking about my retirement account? It's like, so I think that's a much more accessible way to talk about it. But that we see that as a floor in terms of these investments that Congress has made and the President has signed. I myself have participated in the last two international gatherings in Sharm el-Sheikh last year and Glasgow the year before. And it's a fascinating experience, but it's sort of a mixed blessing in that I see all these people talking and gathering, and where's the progress? On the one hand, I think about how is it that 195 countries can produce a document where they all have to agree on everything. That's the way this UN process works, and that you come up with goals and commitments, but every word of that document and that communique has to be agreed to by all countries. And on the one hand, we know it's not enough. On the other hand, I sometimes look at it and think it's somewhat of a miracle that with all of the perspectives and political pressures and biases and what people bring to the table from 195 places, it's somewhat of a miracle that you can even get a document out the door. So I sometimes wonder about how the human condition that we all suffer from crashes into the reality of what we have to do to make our world better and make the lives of our people, not only in the United States, our state here, our country, and the world better. But it's the process we have, and I still see hope. I think that in our world of advocacy, we need to communicate some aspiration, and that we can make progress on these issues and do it in a way that's going to improve people's lives. It's going to create economic opportunity for our communities. It's going to create jobs, new kinds of jobs for our people. And I think that's really the construct that we have to focus on and make investments on. And I think that in this new energy transition, the equity aspect also really comes into play to try to redress, frankly, wrongs that have been perpetrated for so long in these new industries, new opportunities, new jobs, new training opportunities. I think it's incumbent upon us to really focus on how can we bring more people into this world, into this opportunity to make their lives better and to solve these issues. But I did want to turn it over to what comments you have, what questions you have in the time that we have remaining. But I want to thank our panelists for their expertise, for their work, for their willingness to step up and to organize this community in our state for our benefit.
Before we move on, you mentioned the IRA, the poorly named, and this shows kind of where we were going up in the upper graphs. This is similar to that graph we looked at initially. And the net zero pathway is right here, and Build Back Better was better, but the IRA, so-called, really gets us in the right direction, and it's the first bill to ever turn that curve south.
Yes, that's true.
Thank you. Thank you all very much. That was really helpful for me. I've always been interested in the intersect between health and environment in a lot of ways. I work in the clean energy field, more on the finance side for a community development organization in the state. And I work a lot with entities that are applying to us for funding for capital projects that are doing renovation or new construction, could be housing, community facilities. One of the challenges I have is I'm always trying to have conversations and educating them about the clean energy aspects of what they're doing. We're making an investment in their facility, and we want to make sure that they're thinking about the operating costs in the future, and what other benefits doing clean energy projects, energy efficiency projects specifically, could provide them. I was on a call yesterday with an organization. They do recreation for folks. They're nonprofit, and what the conversation came down to was, yes, we're the facility folks, and when we do projects, we try to keep it with a 3-year payback. And I'm thinking to myself, they're trying to make sure the savings from their investment gets paid back in 3 years. And I'm thinking, they're missing a huge piece of the conversation about the costs of them not investing more in longer term paybacks for energy efficiency that makes a lot of sense, and or renewable energy. I had that conversation with them without the health piece of it, and I think the health piece of it adds a whole nother layer on top. But to be able to articulate that, folks like me need a lot of help. And so I just wanted to put that out there. It's a really important piece, because while we look worldwide at the work that's being done, right here in New Hampshire, there's tons of opportunity, even with the incentives that we have at hand. And it's still hard to, quote, make that sale to get folks to think a little bit higher performance building, renewable energy, et cetera. And there's a lot we can share, but we gotta work together. There's conferences such as the Local Energy Solutions Conference that happens every year. We need to grow the folks involved. I've been trying to bring housing folks in, so it's not just the chorus, it's not just the renewable energy folks. We need health folks involved in that too. So I just want to put that out there, and thank you very much.
My name's Chris Camp, I'm Executive Director of the Wyndham Regional Commission across the river. I served on the Vermont Climate Council, then also been part of a lot of discussion around climate migration, specifically on the emphasis on how to make room for those coming, and hopefully also retaining those people who are already here. And the challenge I think in New England, I've lived in lots of other parts of the country, you probably hear from my accent, from a little further south in here, that oftentimes, with the best of intentions, the approach, especially in New England, is the state will pass legislation or make programs available and say the towns will do it. Well, the towns are struggling just to do their day-to-day business, much less plan around climate change mitigation, and especially land use and energy reduction. And so to my mind, it's kind of punting to an entity that really doesn't have the capacity to do it. Since we're talking radically rural capacity, it's a problem. And part of what I've been advocating for, and this gets to a fundamental policy issue as part of the climate migration discussion, but really it's just about adaptation, resilience, mitigation, everything, is we really need to tell ourselves the story of ourselves about the structure of our governance And I'm not sure that, especially in northern New England governments, trying to leave decisions to these tiny geographies. In many cases, no county government or anything to aggregate public dollars in between municipal level and state level to do intermunicipal projects. To do things like investing in basic things like wastewater and water, so you can actually achieve compact settlement and build affordable housing at scale. It's really hard to do in our system. So I think we say a lot of the right things in terms of policy, but in terms of like being able to actualize that policy and make it real, I'm kind of wonder at times, is this intentional? Like we want to say the right things but not actually do it? Or do we just kind of not want to acknowledge it? And then the issue around grants, I mean, we're going to have is a patchwork quilt of, inequitable approaches and injustices because, some communities are going to have the capacity to act, a lot aren't. And then the way the grant funds are structured at the state and federal level, it's this Hunger Games approach where if you have the capacity, you're going to get the grant, you're going to be able to pay the match. And if you're not, you're just going to be left further and further and further behind. There was a lot of discussion in Vermont this year in the legislature about rural capacity, but I think as New England, we kind of need to reckon with ourselves. These little geographies that probably made sense in the late 1700s and 1600s when you couldn't travel that far for 6 months out of the year, may not make as much sense from a practical standpoint in 2023 going forward.
Yeah.
We'll have you take your cards. So what we really appreciate is your thoughts, and there's a basket on the table. Back there's also, sorry. And so please fill these out and leave them in the basket as well. Your comments in this way are also important. Thank you.
Do you know how much, when you talked about how it impacts on when you're born, it impacts on how you're sick. Do you know how much is in Virginia? When you're talking about when how you could be more sick depending on when you were born. Do you know?
I think that Virginia
Mike.
is warmer in here, certainly, so I think any
Microphone.
problem
Use the mic,
here
please.
at Pete is going to be worse. It's going to be worse in Virginia. But,
Could you repeat?
I just,
repeat that, please?
I don't know any specific data about Virginia, but it certainly is warmer as you go south. So I think any heat impacts that we're seeing in New Hampshire are going to be magnified in Virginia. But again, it depends on where you live in Virginia. A wealthy town right around the Washington, D.C. suburbs are going to make sure they protect themselves very well, and the more rural areas are probably going to be struggling.
I think to your point about, whether your family lives in a very small town in northern New Hampshire or lives in, a prosperous part of Nashua, makes a difference because your town is not going to have the same resources to protect you from some of these effects that we're talking about, and trying to make those resources available in every town, every neighborhood in a city like Manchester is, I think, important. But it's a very good question because people being born now have, a kind of lifetime ahead of them that we'd like to be sort of as long and healthy as possible.
I just had a quick question. So it's kind of a three-part question. You might want to wrap it all together. But one is that, we have high school students in the room. We have Drew Kate here in the room. And if there was one thing that you could, maybe just one point that you think that youth should come away with, what would that be? What should they be thinking about? What should they be doing? Is there one thought that they could come away with? And I'd love to know that too, because I would have loved to be here the whole time and listen.
One of the people who did one of our webinars, Catherine Hayhoe, who's a climate scientist and has written a book, what's the book called? Saving Us. It's a short read about what we can all do. And her primary message is talk about it, talk to everybody, talk to your neighbors, talk to your legislators, she feels that we in general are just all too silent about this. We know about it, and we worry about it, and we read about it, but we need to be talking about it in a forthright way and acting.
There's no age limit to serving on your local planning commission. Seriously, or even running for select board or something.
And to reinforce what Carl said, people are nervous about talking about it. Polls do show that 70 to 75% of people in New Hampshire are either somewhat concerned or very concerned about the climate crisis. But the same poll shows that only 30% of these people ever talk about it, because it's almost being a little taboo, because you just never know the reaction you're going to get. In fact, when we give talks in the public, we even strategize about, should we say the word climate change? Because there's sometimes a real reaction to that. And people will, they won't storm out of the room, but it does get the hairs in the back of their neck up a little bit. But I agree with Carl completely. We have to just overcome that and talk about it with our parents, everybody. And kids, parents.
I'll just add, for young people to have the confidence to know that grown-ups want to hear what y'all have to say. At least I think all the grown-ups here. And then the other thing I want to emphasize is innovation, because we've talked about policy, we've talked about research, but we haven't really talked about what we don't know yet that will work, and we need to. And so I think young people are really, really creative and have a lot of ideas that we don't tend to, I think, value as much as we could. So grown-ups to value what kiddos have to say.
I would add to what Carl brought up. It was interesting that he said vote appropriately. And I think that is so important in terms of where we go. And there is a generational difference in attitude, certainly, between, I'm 64 years old, between me and my generation and young people, in terms of their concern about this issue, their deep concern about it, and the strong demand to do something about it. I think we have to get to a political situation where policymakers and elected officials have a fear, and as a former elected official myself, I can speak to it, a fear of, if I don't pay attention to this, I'm not going to get reelected. And I think that's a very practical aspect. I don't think we can solve these issues and really improve people's lives and build community and build a better future without combining the policy levers that we have with the political change that we really need. Because at bottom line, elected officials at all levels of government have to act on this. And the only way in our system, at least for now, cautionary, that we can do this is to participate in the democratic process and make sure that the people that are representing us are the ones that share our values and what we want to see happen. So I say vote, and vote appropriately, as Carl had said.
Hi, my name's Anita Hansen. I'm a local right here, living and working in Cheshire County. And I actually just heard about your organization last week when somebody reached out to me from Claremont, who's part of your group, and heard about what I'm doing here with my organization, which is creating a trauma-informed community. And she was looking at those parallels, and I saw so many in this presentation. I don't think I have a question so much as just commenting on the opportunity that's there for personalizing this very much. I'm looking at everything now through the lens of ACEs and the adverse childhood experiences and the huge public health outcome that and incomes are also involved there, which I think is a really valuable talking point too for enrolling people in the idea of why should we do something about it. There's a lot of information there that speaks to economic impact, as well as just things like who wants to, like we miss being able to just go run in the field with our dogs because now we're worried about getting ticks, and these things that are really universal. But I just was struck by the opportunity here for bringing together more diverse approaches to all unite around these common causes of we want to be more well, and we want to prevent as young as we can these impacts that over the lifespan have a huge economic toll and these social impacts and all those things. So I wonder how you see, if you have time for commenting, I don't know where we are, but how you see that overlap and what potential is there for almost in a sense humanizing this even more and creating more alliances around a few of these somewhat varied causes that are gaining a lot of momentum right now, how we can come together to pursue these common goals.
This is a really jargony word, but I love it. It's transdisciplinary, and it's sort of one level up from interdisciplinary. But the whole idea is you get all these different people together with different perspectives and different sectors, and you innovate. You come up with something you wouldn't have without the coming together of all the different ways of thinking. And then another thought was something that was said earlier in terms of strategy. Who is the messenger and what is the message? And really being creative with how we work together. But I really appreciate what you had to say regarding the coming together of all of us for the common purpose. Though I do think that part of that is better understanding people's perceptions and where they're at, meeting people where they're at, so that we can build that capacity rather than just jumping up to high levels that may actually increase our lack of success. So.
I appreciate your comments too, and I'd have to mention that our coining of the notion of climate-informed care was really came from partly my experience as a pediatrician around trauma-informed care, and that you have to sort of know the impacts of that and know how it affects people personally, talking about trauma-informed services and a trauma-informed community seems like a wonderful concept. I would tend to bring it back in terms of humanizing to parents who have a common concern about the welfare of their children, no matter what their political perspective is. And I think it is or will be a unifying, maybe I'm just biased from my professional background, but the power of parents is something that I really feel strongly about. And we all have either have or have had parents, or we are parents, and that may be a thread that can connect some of this messaging together.
We have time for a couple more questions or comments.
I was going to make one more comment that wasn't in our presentation, and it's one where I could see someone in the audience standing up and saying to us, "Well, Doc, clean up your house." The American Health Care system accounts for almost 10% of fossil fuel production in the United States. If the American Health Care system was a country, it would be among the top 10 polluters. Through waste and through all manner of things, from anesthesia gases to plastic whatever. And what single-use products, COVID made that much worse, probably. But at a community level, I think people can ask the leaders of their hospital what they're doing about this, what their sustainability plan is. The federal government has asked healthcare systems to sign on to a commitment to reduce their greenhouse gas emissions by 50% by 2030 and completely net zero by 2050. And many big healthcare systems around the country have signed on to this. 50% of the healthcare systems and hospitals in Massachusetts have signed on. In New Hampshire, no, none of them have signed on. And this is something that we have another kind of arm of our organization trying to work on. Somebody told me that you don't go to the CEO of the hospital, you go to the CFO, the finance officer, because this is a way to save a lot of money and reduce the cost of healthcare substantially, in addition to cleaning up the air and reducing greenhouse gas emissions.
Part of that problem also relates to the supply chain for the hospitals. And I was reading this recently. I mean, that's the supply chain is, a lot of these companies that are pledging, to be net zero by such and such a time, they're not meeting it because of their supply chains. And so we have to somehow put pressure on those, because that is, for a hospital, that's 80% of their greenhouse gases.
Could I add also that one of the best ways to do that is to prevent as many people from needing to present at hospitals in the first place through prevention. And, it's very underfunded in the United States.
Sorry. You read my mind, I think. I spent, as anybody that gets to be my age, you spend more time in hospitals, either for yourself or for people that you love. And you get to notice some of the things that are going on. The single-use plastics is one. I look at it as a necessary evil, but it should be something that becomes a teaching point for the people that come in. Their kids come in, all ages come in, and they see this happening in a hospital. They say, oh, well, that must be okay to throw away plastics or throw away, what should be recyclable. You can't necessarily do that in a hospital, but that should be something that maybe is an education point to people that come in. And I think the hospital has, I'm glad you're representing the healthcare community, because I think you do have a unique opportunity to educate the public on all kinds of things, from that issue to their own personal way that they can handle climate change, way that they can promote a more healthy community. So anyway, that's just my comment.
Well, we've reached the end of our time together, and I wanted to thank everyone for joining us. Today we have a lot to choose from over the next couple days. You all have your schedules, but there's a wealth of material and presentations that you'll have an opportunity to take advantage of. So thanks so much for joining us here today, and thanks so much for joining us at this conference over the next couple of days.